Hi team, good morning. We're going to start our rounds this morning, and we're going to start with this patient in this room. And Sunita, if you'd give us an update on this patient,
Sure.
of course.
Ms. Smith is a 30 years old female, came in with pyelonephritis and fever. When she came in with a fever of 102. Blood cultures were drawn. She was admitted last night at 9 p.m. She's a full code alert oriented ×4. She spiked the fever last night at 100. Her WBCs is going down. She came in with 15. It's trending down to 13. Complaining of abdominal pain, she gets IV morphine 2 milligram per hour. She's receiving them every so often. She's also complaining of a little bit of nausea, no vomiting yet. She is on IV fluids and IV antibiotics.
You said she's on a diet. Is she eating?
She's eating.
Okay, because she's also diabetic, so we're holding her oral hypoglycemic agents, just keeping on a sliding scale. So for now, it's probably going to be 4 hours if she does not have much PO intake. As her PO intake improves, we can move it to QAC and QHS. Also, the CT scan shows some hydronephrosis, so there's a potential that she might have a stone there. She has a history of stone, so we're going to treat it as urethral lymphasis. Okay. Do you want to go ahead?
Ready to go in?
Yeah.
What's going on?
They told us to have our own stash of it.
My name is Susan, and I'm the charge nurse here, and this is the team. We're going to be rounding on you for a few minutes. Want to introduce the team to you. We have Dr. Kavatsky, and we have Samita, your bedside nurse, who you should probably already know and have introduced. And this is Sandra, our case manager. We're going to spend about 3 to 5 minutes with you going over your plan for the day and for your stay, and a little bit about your discharge planning process too.
Okay, sounds good.
How are you feeling?
I have some pain and a little bit of nausea, but nothing ever comes up.
Where's the pain?
Mostly up here,
Mm-hmm.
and then sometimes in the back.
Okay. Is it getting better?
Yes, but it's still pretty bad.
Okay.
It's getting better.
And you had fever yesterday too?
Just a little.
Okay. So as you know, you have pyelonephritis, which is a urinary tract infection involving your kidneys. We know that you have a history of kidney stones too, and we suspect there could be one trapped there. We're going to get a little ultrasound to see if that complements the findings on the CT scan that you got last night. You are on antibiotics, and that's going to be, for the rest of your stay, that's going to be the plan. We've written it there. You're going to be on IV antibiotics, IV fluids to try to flush a stone there. A stone out, you're going to get some nausea medications, pain control. You can ask the nurses for it. And we're going to start doing clear liquids.
Okay.
Okay? And for today, the important thing is for you to see if we can advance your diet.
Okay.
Okay? And I want you to walk around and see how you're feeling. Make sure you're not too wobbly.
Right. I go to the bathroom fine.
Okay, and you're walking fine around. Have you been out of the room?
Not yet. It's just too painful, but I'll give it a try.
Okay. I suspect you're going to be able to go home tomorrow if you're able to advance your diet, if the cultures are negative, and if you effervesce and the pain is better controlled. So the moment the pain starts getting a little bit better, we'll try to transition you to oral pain medications.
Sure. That sounds good.
And I'm going to start then the discharge checklist protocol based on Mrs. Smith going home tomorrow.
By all means, please.
Okay.
And Ms. Smith, I'll come back and see you in a little while. I know you're only here one day, but I need to find out where you're going to go, what your plans are, if you need anything.
I'm gonna go to my sister's house, but I don't have to ride.
Okay, we'll take care of that.
Thank
I'll
you.
come back and talk to you in a little while.
Yeah. So am I. I'm going to come back and we'll talk some more and I'll do a full physical exam. Okay?
Okay.
We are going to order an ultrasound for the patient, for Mrs. Smith tomorrow. We're going to advance her diet to clear liquids. We'll be going home tomorrow, getting her ride set up afterwards. So Sandra, you'll be coming back and talking with her more about organizing that. And you'll need to make that call, making sure your ride will be here tomorrow, Mrs. Smith, okay? And I think anything else?
Arrange transportation for her.
Oh, arrange for transportation,
Yeah.
okay, because you'll need a way to
Right.
get home then. Okay,
Right.
good. Anything else, team, that we need to talk about before we leave? Okay,
Thanks.
good, thank you.
Thank you.
Thanks.
Okay,
Bye-bye.
team, just met with Mrs. Smith. What I have to do is ultrasound needs to be ordered for tomorrow. I'll give you those notes. Clear liquid diet, advancing her to that. She'll be going home tomorrow. Sandra, you'll need to follow up on making sure she gets a transportation arranged home. And anything else that we need to talk about regarding Mrs. Smith getting her ready for discharge tomorrow?
So I'm going to write for some Vicodin. If you can use the morphine only for breakthrough pain if the Vicodin is not
Okay.
effective.
Sure. And I'll offer her Vicodin before the IV.
Sure. Thank
Okay,
you.
good. And here are your follow-up notes, and your orders.
Thank you so much.
Mhm.